Okay, let's talk about cancer. It's a big one. I think a lot of people have known someone who has been through cancer. Some have been successful to overcome it. Some others haven't. I know I've had that experience in my own family. So it's a I think we know. I think many of us know what cancer is, but I think we should get into the details to help you understand it a little bit better. So this first video that you can look at, if you can't get it right off this PowerPoint, it should be in Pages where you can pull it up. It's a pretty good overview of what cancer is and some of the things that we're doing for it. So please watch this video. You can pause here and then go find it, watch it, and then come back because it'll really help with the rest of these slides. Just a quick overview then, once you've seen the video, hopefully you've looked at it. So we're talking about a neoplasm. That is a cell that doesn't serve any function. And so a neoplasm you can have a neoplasm and that's fine. And if you have a whole group of neoplasms together, we can call that a tumor. If the tumor is not cancerous, it's not spreading, right? It's just an ineffective cell or mass. We call that a benign tumor. Now, if that tumor then spreads and starts to limit the function of other cells, then we call that a malignant tumor. That's cancerous, and that's what we don't want. So we have benign kind of tumors all the time, right? So sometimes our body just takes care of them. We don't even know they're there. The problem is that when these tumors begin to spread and then affect other cells, and then those cells can't perform their function, then that's considered a cancer. Now, if you have enough cells that don't perform their function, then we have big problems. Like if your lungs don't perform a function, lung cancer, then we die, or things like that. So metastasis is the spreading of those cancer cells to other organs. So if it starts, let's say, in your lungs and then it spreads to your endocrine system or some other system, muscles or bones, then that's that's metastasis. And we don't want that. If we're going to have a cancer somewhere in our body, let's try to keep it there and get rid of it from that spot before it gets too complicated, because that different radiations, different chemical treatments, different drugs, things like that come into play when it starts to hit different organs. So anyway, it disturbs the DNA so they don't reproduce correctly, and that causes function problems in our body. So who gets cancer? Well, it's the second leading cause of death. It's 1 in every 4. Typically people who smoke, and that's once again, it's nicotine. It's just not the smoke. It's the nicotine as well. Poor diet. People who are physically inactive. People who are obese. People who are out in the sun too much. And different types of radiation exposures. Typically the common causes of cancer. Genetics can have something to do with it. You can have genetic markers for breast, ovarian, and colon cancers. That can be tested for. And in a lot of ways, we're all prone. We all have some sort of genetic code for cancer. I mean, humans have been on this earth long enough to have developed some poor genes, and so we have it. It just depends on, if you're exercise and you eat well and you control your stress and you get good sleep and practice safe sex and you stay out of the sun and all those things, you're going to better your chance of not getting it. However, there's, because we all have that kind of genetic, we're human, there's a chance. So there are some disparities in cancer rates. So if we look at why people are getting it, it seems that people who are at lower poverty levels tend to get cancer more often. And a lot of times it's because they're not being treated for it, or poor nutrition, or higher stress levels, things like that. So for example, just lower socioeconomic status. So African Americans, they have the highest death rate of cancer, followed by white, then Hispanic, Asian, and then American Indian men. White women have the highest incidence of cancer. So if you go way back to the first set of slides, topic 1, and we looked at incidence. Incidence is the number going into the pool. So white women have the highest incidence, but Black women die more often from cancer than white women. And then once again, it's a matter of how good a care that you're getting, or the recognition of the cancer, and all of those different factors. Better recovery. So once the cancer is gone, then the ability to have good nutrition and be able to rest and not have to go to work and take care of yourself, things like that, help. So white women get cancer more often, but black women die from it more often. It's just a disparity. Okay, so there's lots of reasons. So you can have a thing called a spontaneous error, and a lot of times our bodies just kind of take care of that spontaneous error. But if they don't, that spontaneous error can reproduce over and over again and cause that DNA to produce a poor cell, and then of course then the organ that it's within then doesn't perform well. You can have an external agent like an X-ray or a chemical exposure or something you breathe in or one of those things. That's an external agent that can start to cause cancers as well. Radiation is a big one. You can have poor genes. The agents lie within the genes, and that they get triggered because of stress or poor nutrition or just age, and they can develop into a cancer. So those are some other causes. But the most important cause is smoking, obesity, and viruses that we pick up. So make sure those are the things that we can pretty much avoid. We can control. So we don't smoke. We watch what we eat, and we practice a healthy lifestyle by controlling our stress. Our immune function is good, and getting enough sleep because our immune function is good, and we can fight off a lot of those viruses. So other causes, we can have hormone or immune conditions that don't allow us to fight off that stuff. And we talked about the chemicals and lifestyles and things like that. So basically, if you live a sedentary life and your diet is poor and you drink and you smoke and you have increased stress, then your lifetime risk increases. That means that your probability of developing a cancer and dying from it increases if you have those lifestyle factors or you know someone who does. The relative risk there, though, there is a pretty strong relationship between those factors and different types of cancer. So smoking, obviously, lung cancer, poor diet, colon cancer, sedentary lifestyle, all kinds of cancers. So understand that you can do things to decrease your chance of getting cancer, especially at a younger age. This doesn't mean you're going to rid yourself from it. It just means that you're going to increase your chances of not only not getting it, but surviving it if you do have it. So smoking is probably the greatest risk factor, and obesity is close behind that one. So don't do those two things. So don't let those two affect you. We can have genetic and gender issues. Obviously, there are certain cancers that women get more often than men, and vice versa. Certain cancers run in families. There may be a disposition in your genes, heredity may allow for that. So for example, we all know Angelina Jolie, and she had a family history of breast cancer, had a genetic marker for it, and so as the media reported, she had a double mastectomy and didn't have cancer, but she knew that she had a genetic marker and a genetic disposition, so she had a double mastectomy. So anyway, I guess you could do that, but my grandmother on my mom's side had breast cancer, and my mom has had benign tumors, so she checks often. So it runs in that side. It runs in our family. There aren't any more females on my mom's side, so I just have a brother. So no more risk there, I suppose. But anyway, there can be genetic factors. Occupational, definitely work hazards, depending on where you work. If you're around a lot of radiation or pesticides or herbicides, or you're in a very dirty environment, you're breathing in lots of poor air, it can certainly increase your chance of getting cancer. So just be careful. If you're outside a lot, you got to protect your skin so you don't get skin cancer. We'll talk a little bit more about skin cancer here in a second. You got to control your stress. You got to get good sleep, and sleep will help control the stress. So they're not like way up there in importance, but they really can help. If you lower your stress, then you're less likely to self-medicate with alcohol or to nicotine to control that stress, and so you limit those factors. Or you don't eat as much, or you don't use food to control the stress, or what have you. So good sleep and proper controlling of your stress can, in a roundabout way, help prevent cancers. Certainly look at the food. We talked in nutrition about the foods, and be careful of certain viruses. Obviously, not being a habitual drug user or practicing safe sex will certainly keep you from getting certain types of viruses that will cause cancer, like hepatitis. And then be careful with and with cervical cancer. Cervical cancer is an interesting one. They've found the reason for it. It's called the human papillomavirus and the HPV. There's a shot that you can get anytime. Male and female can carry human HPV. So if you get the shot, then you're going to protect yourself from that virus. Here's the thing. Men can carry it and not show any symptoms of it, and then expose their partners to it. So if a guy is kind of promiscuous and picks this up in his, teenage years because he's had multiple partners or what have you, and then gets married and lives a monogamous life where he just has one partner, he can actually pass HPV on to the wife. Now, if the wife never had any other partners but him, she can get cervical cancer because of HPV because of him. So be careful. You can get a shot early in life that prevents HPV, and then you don't, obviously you should still practice safe sex and be smart, but that's one way to prevent cervical cancer. So cervical cancer is a big one, and we can prevent that, HPV. So if you haven't looked into getting that shot, you still can. It's available at the doctor's office. Obviously, there are some medical factors. Estrogen replacement therapy, there's some conflicting research on whether or not it's a risk of cancer. There's some research in there for breast and other cancers. And chemotherapy, a lot of times they use chemotherapy to treat a cancer, and it may increase the risk of other cancers. Your oncologists, your doctors who do cancer stuff, they're pretty smart. They know the risks, and so they'll give you just the right amount, and the good ones, and they're all good. Those oncologists are pretty smart. So, but there is a risk. So here's some different types, and there's lots of huge broad classifications of cancer. So carcinomas, sarcomas, lymphomas, leukemia. So there's your list, and we're going to go through some of the ones that are specific underneath that. So like carcinomas, sarcomas, and that. So we'll look at particular cancers under that list. So as we go through the cancers here, you can go back to this slide and say, oh, that's carcinoma's breast cancer or lung cancer. Oh, sarcoma's bone muscle. Oh, I see. You can do it that way too. So if I don't mention it specifically, come back and look at this list, and you can see this is the broad list, and now we'll talk about the specific ones. So this is lung cancer. It's the #1 killer of all cancers. It occurs for both men and women. Here's your symptoms, and certainly they could do surgery and radiation and chemotherapy for this. The idea here is to preserve as much of the lung as possible. So obviously we can prevent lung cancer from occurring drastically if we don't smoke and stay away from tobacco. And of course other industrial chemicals, very, very like polluted air, things like that. So most of the time if you have lung cancer, only about 13% live longer than 5 years. So it's a pretty rampant killer. So well into the 80% death rate there within 5 years. Breast cancer, it increases with age. It's the leading cause of death, cancer for death for women. So the #1 would be lung. #2 for women is breast cancer. So you can find this, you can do self-exams to find this. You'll find lumps or thickening, irritation. You might even have some tenderness around the nipple and discharge. So if that starts to happen, and it can happen in any age, more prevalent in older women, and anywhere along from the armpit in towards the nipple and around the nipple. So you can do a self-exam. There are websites that'll show you how, YouTube videos that you can see how to do it. But basically you're just going to trace that lymphatic system up and around the breast and look for any irregularities as far as tenderness, thickening, and lumps. So if you can find that, and you find it, it's pretty persistent, and you can go get it checked. They can do different tests, mammograms, things like that, to determine the type of what kind of lump that is, and if it's dangerous or not. So colon and rectal cancers, it's the second leading cause of cancer death overall, and it's really prevalent in men. So rectal bleeding, bloody stools, you're going to have some bowel changes. You might get constipated as those polyps. If you look at the top right, that big mass in there is called a polyp. If that gets too much, it'll block the it'll block the passage of your stool or your feces moving through. So people over 50, and if there's a family history, it increases your chance. Sedentary lifestyles increase the chance of colon cancers, poor diets, things like that. So you can get radiation and surgery. They'll actually remove your bowel. It's called a bowel resection. They'll take a chunk of your intestine out and then just sew, the two ends together and remove the cancer. So anyway, there's good treatments for colon cancers if you can get it early. Prostate cancer, obviously, it's the second leading cause of death for men, which would make sense because women, you don't have a prostate. So the prostate is located at the upper end of your urethra next to your bladder. And you can get a check by the doctor. They can, through the rectum, they can feel an enlarged prostate. Most doctors don't do this anymore. They have pretty good blood tests that show markers for this. There's things in your blood that says you have an elevation in of certain markers that tells you that you might have a prostate issue. 70% of all cases occur to people over 65. I asked a doctor one time, what is something that people can do to prevent prostate cancer? And he's still practicing today. He said to me, well, they can die young. And I said, what do you mean? He says, most men in their 80s are going to have some form of prostate cancer. They may not know it. They may not have symptoms. But when they die, and they could die of something else, they'll probably have a form of prostate cancer. So most men, we're going to get prostate cancer, especially if we're sedentary and we have an issue with obesity. Good chance you're going to have it and know it. But most men in their 80s and 90s, if you live that long, you're going to have some form of prostate cancer. So it's just what it is. It may not kill you, but you'll probably have it. Increase your intake of fruits and vegetables. They found that is really, really big on the prevention of prostate cancer at a younger age. I know 4 or 5 guys who don't eat vegetables at all. It's just not part of their diet. 4. 3 of those guys have had prostate issues. The 4th one, I'm waiting because he's still kind of young. So she's just getting into his mid-30s. So I'm waiting. Everyone else is in their 50s and they've already got prostate. And they just didn't eat vegetables. So maybe there's some truth to it. I don't know. That's what I saw. 4 guys that I know that don't like vegetables and fruits, they had prostate issues. There you go. So skin cancer. Skin cancer is interesting in the fact that when they talk about cancer rates, they leave skin cancer out because so much skin cancer that it throws all of the other cancer rates out. Right? There's not a huge death rate for skin cancer, but it's really, really prevalent. So it happens a lot. So when they say the cancer rates and these are the most prevalent cancers, they don't even look at skin cancer because it would be like the bar would be like skin cancer and then all the other cancers. So skin cancer is huge. Risk factors: fairer skin, you're blonde or redheaded, light-colored hair, blue, green, gray eyes. That just tells you where just your genetics. I mean, if you're Northern European descent, you're bigger chance of skin cancer. So if you burn easy, make sure that you're using a sunscreen with SPF. The number means how long it can be applied and stay there. So if you put 30 SPF on, it means that for 30 more minutes, you're less likely to get burned. So, than if you didn't have any on at all. So if you have one for 100 SPF, that gives you 100 minutes. So just reapply. You can use 30, just keep reapplying, and it'll help prevent skin cancers. There's different types: basal and squamous cell. Anyway, you can read that too. Look at the ABCD rule. So asymmetry, is it even around? Is there border irregularity? Is there some color? Is the diameter getting bigger? 90% of the time, a doctor's just going to cut this off your skin. So those 2 pictures are both obviously skin cancers. So testicular cancer, I put this one up here because it's really prevalent. And what I want you guys to look at is the age group. So your age group is between 15 and 35. So if you're between the ages of 15 and 35, and I'm willing to bet that everyone taking this class, guys, is between 15 and 35. And if you're not, then yeah. But good for you. But it doesn't mean you're out of the ballpark. But you're at the greatest risk between 15 and 35. This is not painful. So if you get a lump in your testicle, you're probably not going to notice it because of pain. So it's probably a good idea to do a self-exam monthly. Probably don't need to do it more than that. And you're just looking for a lump. So get familiar with what the lumps are in there. There are different kinds of tissues in your testicle that may feel funny, but you're going to be able to feel a lump, and it does. It feels, you're going to feel something that is not part of the normal structures in there. So it'll feel like it's just kind of, a pea that's stuck in there. So do a self-exam. It's the best way to do it. 15 to 35, that's your age group. So ovarian cancer, and specifically I want you to pay attention. These are your ovaries, not your uterus. That's different. So there's really non-specific symptoms here until the late stages. So you're basically, it's gonna kind of be painful like a menstrual cramp, and you're gonna be like, oh, that's weird. And it's probably gonna come on and off like a menstrual cramp. And so there may be some bleeding, like if you're menstruating and things like that. So know that if you have a family history, you're getting older, you've never been pregnant. So if you're in your 40s, you've never been pregnant, and you start having abnormal bleeding and some weird pains, you might want to get checked. Especially if you're not an exerciser, you don't sleep well, you don't manage your stress well, you're a smoker, you've had early sexual relations, so like you started really young and you've been very sexually active, and now you're in your 40s, there's a good chance that you may have you can get an ovarian cancer. Same with uterine cancer, so be careful with that. So endometrial cancer, which is uterine cancer, usually develops in the lining of the uterus. Once again, this has different types of symptoms early, and they change as you get older. Same ideas with ovarian cancer, early ages of first intercourse, multiple sex partners, smoking cigarettes. If you've had certain STDs or STIs, then you're increased chance of uterine cancer. Pancreatic cancer is a nasty one. If you have a pancreatic cancer, the death rate's pretty high. Less than 4% live longer than 5 years. So if when I hear people have pancreatic cancer, I just cringe, because I know it's just tough. That's a tough one to. The pancreas does too much, and so if you have a poor performing pancreas, you're not going to live long, and it's really sad. So look at your risk factors: obesity, sedentary, cirrhosis of the pancreas or the liver, high-fat diets, smokers. So there you go. You can do something about decreasing your risk factors. Leukemia is blood-forming tissue within the bone. So it forms. What happens is you form a ton of immature white blood cells, and so if your white blood cells are immature, you can't fight off infection. So you'll probably have leukemia. Leukemia is the cancer that forms poor white blood cells, but the white blood cells fight off infection. So you usually die of something else like pneumonia or some other weird like infection in your body. So fatigue, paleness, weight loss, you bruise easy, nosebleeds, things like that, typically a good sign of leukemia. You can look over on the right are common symptoms. Leukemia is not, the survival rate is pretty good if they catch it. So just any one of these symptoms, even when you're like, man, maybe if you think you have mono and you go in and you test negative for mono, sometimes they test you for leukemia too, just to rule it out, because it's kind of a lot of the same symptoms. So especially at young people your age. Okay, so that's leukemia. So there's lots of things that we can do when we're facing cancer. There's really good tests now to rule it in or out, and so that's good. You just got to get to your doctor. You got to pick up on the symptoms and get to your doctor, and then they can diagnose you, and then they can begin treatment. The earlier we start treatment, the better. They're trying not to remove tissue as much as they used to. They're fighting it off with radiation and chemotherapy. They're getting really, really good at chemotherapy, where they're targeting just the cancer, and so they're leaving the other tissues alone, because that's really what really messes people up with fighting cancer. We're talking about like lung cancer or breast cancer, and people are losing their hair. Well, that's weird, right? I mean, so they're getting better. They can now fight some breast cancers, and it's not, lose as much hair because of the side effects of the chemo and just things like that. So we're getting better and better at fighting particular cancers. And if you watch the video in the beginning, you know that it's complicated. One cancer doesn't act like another. And you can have breast cancer in one person and it acts completely different, and it acts completely different in another. So realize that. But we're getting really good at it. Cancer research is really coming along, and it's getting better and better. Make sure that you get it done soon. Make sure that you get to a good doctor group, that they're not only treating you for the cancer, but they're helping you with your family and your stress levels, and you're making sure that, everything else, good nutrition, and you've got support groups and things like that. So there's some great government-funded research out there. I had a neighbor who had breast cancer. She went in and she got involved because she was so young. She was able to get involved with a government-funded, or it may not have been government, but a research-funded program. They did some things to help prevent hair loss. That was one of them. And part of her program is she did have to have a mastectomy, double mastectomy, but they reconstructed her breasts right away. So they went in and removed them and reconstructed. So that was part of that research grant. So that was pretty cool. So she was, she beat the breast cancer. She had a mastectomy, but she was able to, psychologically and socially and all that overcome a lot because of grants. So you can look into that too. That's all part of fighting cancer. So I hope this was informative. I hope you're doing well in your discussions. I hope that you watched that video. And if you have any questions, please let me know. Thank you.